edition of the Dr. Kre Me Show. I hope you guys are doing well and had a rested holiday weekend. Come on in. Let me get going on here. And we're going to talk about, I got a lot of stuff to cover today because we're going to talk about the new symptoms of coronavirus in kids. So tag a friend, share, and we'll go on from there. Hey, Katrina. Hey, Montez. Tag away, guys. Call your friends into the room. And hey, Jacondra, we're going to get y'all educated on the new stuff that's going on with coronavirus. Lots of new things that are going on. Things are opening up and kind of scary, but hey, Pam. Things are opening up and we are going to get going. So did y'all have a good weekend? And did you all travel? Let's see. All right, I'm tagging my pages. Hey, Kamiko, we're gonna get started in just a moment. I don't see that group. I promise them. Yeah, let's get to talking about this. Hey, Donna. All right. So anyway, this Dr. Kre. I am your board certified family medicine physician, and I specialize in helping overwhelmed, overworked, everyday people learn more and more about what's going on in healthcare, that be it everyday healthcare concerns. Right now, it's all things coronavirus, COVID-19. That means things that are concerning to you. It concerns me, and I want to get you well educated because I know that when you know better, you do better. Okay, so let's get to doing better. So today I wanted to first, before we talk about getting into sports and what our kids should be doing or not. Hey, Miss Yetta. Hey, Barbara. I wanted to talk about these new symptoms that are being seen all over with kids. Now, so all a small percentage of children are starting to be diagnosed with what's called multi-system inflammation in children, right? Or MIC in kids, okay? So multi-system inflammation it's a long term in children. So first and foremost, be mindful that these children with the multi-system inflammation, they may not have had not one sign or symptom of coronavirus, okay? So it's not like you can be like, oh, they did have a cold, they had some shortness of breath, they had some coughing. They may not have any of that. And then all of a sudden, it seems to be out of the clear blue that they have a fever, a temperature of greater than 100.4 for at least 24 hours. You try your Tylenol, you try your ibuprofen, you're like, man, you're just not breaking this fever. The fever can last up to about 5 days. So between 24 hours up to 5 days. And this multi-system inflammation of children associated with coronavirus. So first of all, they have these high fevers greater than 100.5. They can also have cracked lips or really red lips, like really chapped, cracked looking lips. Like, I know good and well we've been drinking enough water. Hey, Felicia, I know you've been drinking enough water. I know you've been eating, you've been hydrating. Why are your lips so cracked? And they can have the high fever. So usually they're gonna have this fever, and then they'll have plus or minus. Hopefully, to get the diagnosis, you usually need about 4 of the 5 things that I'm about to describe. Because in old days, this was what we were seeing that's called Kawasaki's syndrome. So in residency, I saw it one time. So it's something that it happens, but I haven't been privileged to see it a whole lot, but it's out there. But I want you guys to know that the symptoms, in case you wake up and you're like, what's going on? So anyway, children can have a temperature of greater than 100.4. They may have cracked lips. They may have swelling in the hands, swelling in the feet. They may have redness of the hands, redness of the feet. They can have very severe joint aches and pains. So you've been outside running, you've been outside playing, you've been jumping, skinning a cat, you went to bed and was fine, and then this morning you woke up, you can't bear weight on your legs. So severe joint pain, and they can have this diffuse rash. So let's review this. Somebody write these in the comments. Hey, Dr. Dina, we're talking about multi-system inflammation in children. So these kids, this can be associated with coronavirus, right? So the association with coronavirus is that the children may not have had any symptoms leading up to this, to coronavirus, and then all of a sudden they have what I described. Plus you take them to the doctor, they're tested, and they're either their regular test is the nose test that you see them sticking down, that can be positive, or they have positive antibodies. So this is kind of a conundrum of sorts. So they have their fever greater than 100.4, dry, cracked lips. They can have red eyes, that both of their eyes are red, but they're not having a lot of drainage. So let's start from the top. They got a fever. Their eyes can be red, both of them. So they look like they got real bad pink eye, but there's no drainage. Their lips can be cracking. They can have big, large lymph nodes in their neck, at least 1 to 1.5 inches in size. So it's got to be a pretty, large lymph node. Little kids have a lot of little shoddy little lymph nodes. Little small lymph nodes feel like a little grape movement. But if you're like, man, this is a big lymph nodes, lips are cracking, hands are red, hands are swollen, feet can be red, feet are swollen, and then their joints are exquisitely tender. So back in the day for Kawasaki's disease, we'd say you'd have to have about at least four of those 5 symptoms that I just described to have, to meet that diagnosis. It didn't have anything to do with COVID back then that we know of, but now it is starting to be something that is so very positive. So here's the concern. So the concern is they've had coronavirus. Kids are asymptomatic carriers. Remember, guys, kids may not have, your children may have it. They may not have any symptoms. Then one day they wake up, they got a fever of greater than 104. Both of their eyes are red, but they're not draining. Their lips are cracking. Their lips are really red. They have big lymph nodes in their neck. Hands are red and swollen. Their feet can be red and swollen. And then their joints are just really tender. So all of these things can be associated with multi-system inflammatory syndrome of children. So why is this a big deal, Dr. Kre? This is a big deal because that inflammation gets into the arteries, which causes the heart to have problems. So these children can have long-lasting heart effects. So say, for instance, they can have heart disease, why would a child have a heart disease? Heart-related disease. Heart disease, they can have heart failure. They can have irregular heartbeats. So they can get, feel better. And all of this goes away within time, but they can be left with these long-lasting, issues that can bother the heart. So we need to be mindful. If you see any of these symptoms in your children, be sure to get your kids to the nearest hospital, to the nearest urgent care. For the first month of coronavirus, everybody's like, stay at home, stay at home, stay at home. Don't go to the hospital. So no. Now know yourself enough to say, is this something that we stay at home for? Or is this something that we go out and go to the ER for? This would be something to go to the ER, guys, because treatment is usually one of the times that kids can get high-dose aspirin. Usually in little kids, aspirin is a no-no. This is that, and then they have what's called an immunoglobulin, which is an IgG immunoglobulin that they give, immunoglobulin. They give you this, and that gets the kids to feeling better. But that has to be given IV. This is not anything that you sit home and you say, hey kids, we're going to just wait this out. So no, if your kid isn't acting right, if they're talking about their joints hurt, get them in to be seen by their doctor or to the urgent care or to the ER if all of these symptoms seem to be in place, because they may need IVIG or high-dose aspirin, that kind of thing. So be very concerned, because we do not want to have any long-lasting effects. So for the newcomers, let me tell you about this. Multi-system inflammation in kids can be associated with coronavirus. These children may not have had any symptoms, but you get there, they test them, and they're positive, either in their nose or they have the antibodies. Hey, Darvon. They have a fever, at least for 24 hours, okay? Excuse me, can be up to 5 days. Remember, your fever is greater than 100.4. Eyes, Eyes can be really, really red, but not a lot of drainage. Cracked lips, swollen lymph nodes here, swollen hands, red hands, swollen feet, and very severely tender, painful joints, and that rash. I think I left rash out before. All right, so that's that. If you see any of those things, get your kids checked out. That isn't a waiting game. We don't want to play the waiting game with that. Now let's talk about sports, guys. So I've been contacted by some coaches and a lot of people trying to figure out, well, what should we be doing? It's coming up. I'm in Alabama. I'm not sure where you guys are watching from, but in Alabama, they're allowing for activities kind of pick back up. Gyms are opening or have already opened. Football and baseball and all of these sports are starting up again. So my recommendation to you as parents is, number one, first and foremost, know your kids and their risk. So remember, a vulnerable person, someone that's vulnerable and that can get coronavirus, is more likely to get coronavirus. Remember, high blood pressure. There are some kids that can have high blood pressure. If they're diabetic, they're high risk for being sick. If they have asthma, your child is high risk for being for having coronavirus. Even if there's some talk about that, maybe they are with asthma. Now, I would still be on the safe side. If your kid has had a weakened immune system, say for instance they had early childhood cancer, they've been in remission, you don't even thinking about cancer, you have to go see the doctor once a year. Revisit your children's history. And if they have a known risk, you may say, this summer we're going to sit it out. This summer we're going to just sit it out. We're going to wait it out and just see. Okay? So I would challenge you to, one, know your kids' risk. Two, call the kids' pediatrician. If your children have not seen the pediatrician in the last year, make sure you schedule an appointment with the pediatrician. So call the pediatrician and say, hey, you know my baby just as good as I do. Should they be out there playing contact sports? Should they be out there doing all of these things in the enclosed areas where, yes, they're trying to do 6 feet of spacing, but you know your kid. I know my kid better than anybody else. And I'm sure that, being that distance, and you have to be distance for hours when they're practicing. You a lot of times they're not letting parents sit in on the practices. So know your kid, know their history. Know your history, and then know that the rules are set. Look on your state's website and say, what is our state saying about sports? And then also, somebody type this in there. Look up your athletic high school association for your state. Your state. So ours is the Alabama Athletic High School Association. So that's who we will go to if we want to look up and say, well, what's the rules on, what really are the rules on sports? So look up at your state level, look up at the local level, but also do not forget. So you say, hey, my kid is just in middle school. Still look up at the Alabama or your state Athletic High School Association recommendations. And for the state of Alabama, I actually have some recommendations here. So this says, when can the people in Alabama begin their summer activities? So as far as Alabama is concerned, June 1st is when they can begin summer activities. However, you need to confirm that with your local school, with your local coach. Call them and say, well, when are you guys allowing the children to get back in? So they're leaving a lot of judgment up to the school. So it says, okay, June 1st, but also talk to your local administration. So your principals and the school athletic association may be coming up with some plans for your area. So call ahead and say, well, what's really going to be our rule? And ask questions ahead. So these, if you're just joining, these are the recommendations for the state of Alabama. Go to your high school athletic association for your state website, and they should have some similar questions. All right, so all students will be required to have an up-to-date physical and concussion form on file. So if you've not seen your doctor, the last few months, doctor's offices have been closed. Make sure that your children have up-to-date physicals. That would be a great time to talk to your pediatrician or your family doctor during that visit to say, well, hey, is it okay for Johnny to go and play sports this summer? Is it okay for him to get back into track? Is it okay for him to get back into football? That way that your pediatrician can let you know. So all students must have a current pre-participation physical, a consent form from the parent, and then a concussion form on file. So you got to make sure so you'll know what they're limited and all of that about. So listen, it's your responsibility as a parent to be able to have these conversations. So you're gonna talk to your local school system and monitor what the Department of Public Health is saying. Monitor your local health departments. So monitor those things and say, well, when in doubt, call and ask. I would rather you ask and know and then not. So get this, guys. Remember when we were talking about, we can't have any less than 10 people. So that rule is out for sports, at least in Alabama. So do we have to work in groups of 10? No. The Alabama High School Athletic Association says no, we don't. Group size is unlimited as long as they are doing social distancing. I'm not sure how that can happen with social distancing with kids. So no small 10 or less, they're not requiring it as far as Alabama Athletic Association. Hey, Commissioner Turner. So they're not requiring it. So group sizes are unlimited as long as children can do social distancing. Okay? That's in Alabama. All other guidelines should be maintained. Coaches, talk to the coach, talk to the athletic association, the athletic director for your school. So it says, can an athlete participate without a mask? They're saying they recommend that children wear masks. They recommend the mask be worn to the extent that's possible. So if your child is running track, you know that the mask is probably going to be out. So a lot of it is up to interpretation. A lot of it is going to be up to the coach. A lot of it is going to be locally. Let's review this. In Alabama, June 1st is when it's okay to go back and do summer activities. But you must have your pre-participation physical on file, the concussion form on file, and a signed consent. And I'm sure they're going to have you sign a waiver or something like that. It's your responsibility as the parent to talk to your local school, to talk to your the district, the board, figure out what the rules are going to be. There is no limitation of 10 or under as far as the athletic association goes. So the group size is unlimited. If that makes you nervous, then remember, know your child's risk. Is your kid at risk for having does your kid have asthma? Do they have high blood pressure? Do they have diabetes? These are things that you may be like, this is too much because I don't trust my 12-year-old to be out there talking about social distancing. So can an athlete participate without a mask? Facial coverings are recommended. This is for the state of Alabama, y'all, to the greatest extent possible, and should be worn when activities require a person to be closer than 6 feet. So if you're saying we got to be pretty close to each other, okay, now you get into semantics, because what if you're playing football? Everything is close. So a lot of this is kind of, up to the interpretation. Multiple sports teams, guys, can use the same location, same facility at the same time. In Alabama, that answer is yes. If physical distancing is practiced and teams do not interchange. So say for instance, y'all out on a big football field and the flag girls are over there, it's 25 of them, and the band is in the middle, and the majorettes are over there, then that's fine as long as you can be social distance. So if you see these rules are kind of hard to kind of muddle through, who can be present during activities? Only school personnel, coaches, athletic trainers, student athletes should be present during the activities. Non-essential personnel should not be present. So they're going to try and limit the amount of people that are there during practices, okay? So you can't, if you're used to going and sitting inside the gym and watching your kid practice every Tuesday and every Thursday, you're not going to be able to do that. Let's see. How often does equipment need to be cleaned? So these are some questions that you can take back to your coach. How often are you going to clean the equipment? It's the pads, the mats for wrestling or whatever. How often are you going to clean those things? So this says all equipment, surfaces, weights, benches, balls, helmets, gloves, they listed all out, should be cleaned after each activity. Individual workout or skill development. Avoid sharing equipment. So these are conversations to start having with your children, okay? Start having these conversations like, okay, guys, don't be sharing, don't be drinking behind each other, don't be, waterfalling or whatever kids call it. And then lastly, can we have summer competition and team camps? No, they are not supposed to be having summer competition and team camps. In accordance to the ALSDE guidelines, school-sponsored activities, schools may only utilize static groups or your own students or freer school students for the duration of this order. So, for example, the school may hold camps for their own students, but not for interscholastic camps. So, you need to talk to your board about that. And then lastly, can they do tryouts? They're saying that mandatory summer practices are prohibited, but weightlifting, conditioning, and practicing is something that they can do. So I pulled all of this information off the Alabama Athletic High School Association website. So let's go back to the basics. First things first, know your children. Talk to their doctor and see if they are a good candidate to continue on with sports during the summertime, during the fall. My baby's in gymnastics. We had to pull her from gymnastics because she's high risk. We talked to her doctor, we talked to her pediatrician, and we talked to her kidney specialist, and that was what we came up with. And we'll make it work. We may have to do some one-on-one stuff. Make sure your kids don't lose their skill because of this, but we may have to be creative, right? Also know that the rules may change. What I just read to you guys were Alabama rules, right? Those are Alabama rules. They're not supposed to be doing a whole bunch of stuff, but they can try out. Now, your county may be saying something different. Your school may be saying something different. A lot of that was left up to the interpretation of your local schools. So if you're concerned and if you're in a different state, I would start with talking to the school, talking to the coach, and going and pulling the record saying, well, the state said this and y'all not doing what the state said. The government said this, y'all not doing it. And our athletic association or our governing body for AAU said XYZ. Have your receipts, guys, okay? Say that. Don't be afraid to challenge people and say, that's not what it said. That's not what we're supposed to be doing, because we're talking about children's lives. And let's review what the kids can get nowadays, because we've been saying that children are a protected species in all of this, and that they are not really getting sick, the sickest of the sick. But we know that we've seen infants die to people 100 years old dying from this. So no one is exempt. But multi-system inflammation of children associated with COVID-19, they may have fevers greater than 104. Both their eyes may be red but not draining. Red, cracked lips, their tongue may be cracking. They have big swollen lymph nodes in their neck. Hands and feet may be red and swollen, and they have really tender joints. Standing up may be a big deal. Their elbow may hurt. You're like, you didn't hurt yourself yesterday. Oh my gosh, why are you acting like this? And they could have a rash, and sometimes it's predominantly in their groin. So be mindful, know your kids. Ask questions, and use your intuition. Mamas and daddies have the best intuition. When in doubt, if you're concerned that your child may be high risk, that's asthma, that's high blood pressure, that's diabetes, that's morbidly obese, because kids are coming all sizes. If you got that kid that has all of these things and that they're not going to be able to social distance their children, for God's sakes. My baby saw somebody she hadn't seen, and she knows coronavirus, we need to stay away. We gotta wear a mask. I looked up, she was hugging this little girl as tight as she could. And I was like, oh my gosh, you gotta stay away. And she said, but Mama, I missed her so much. She said, I hadn't seen her in a long time and I just totally forgot. Your kids have been missing out on a lot, guys, over the last 2 months. A lot of touching, they feeling, they loving on the teacher. That's been taken away from them. So be mindful, have these talks with your kids. Talk to them about safety. Talk to them about why they may or may not be able to continue with the sport that they absolutely love if it's gonna be that, if it could be detrimental to their health. And once again, talk to their doctor. Schedule an appointment. If you are in Alabama, the Athletic Association are requiring you to have your physical anyway. You got to get the concussion form cleared. You got to sign off on letting them get out there. And if you take the risk, you take the risk. But know the risk that you are taking early on so that you can say, well, I have made the best informed decision for my child, because God has given us these children, and it's our job to be good stewards over them. So be the best steward you can. Make the best and most informed decision that you can. When in doubt, ask questions. Ask questions. Ask as many questions as you can. And somebody asked about brownstone. We are going to start slowly transitioning back into seeing patients starting June 1st. We'll either see people over video. We're not doing any more phone visits. We'll do video visits or in-person visits. And then we'll still, use social distancing. The waiting room will still be closed. People will be waiting in their cars. We'll be cleaning everything off after everybody comes in and out. So we'll slowly try to get people coming back in. But that'll be starting June 1st. And hopefully that helps you to know that, do your research, right? Do your research as far as your kids are concerned at the state level. See if anything's written at the local level. Contact your governing body. If that's AAU, if that's the High School Athletic Association, which usually everything trickles down under that. Talk to the coaches. Talk about your concerns. Pray about it and decide if you should continue with it or not. Remember, wash your hands, wash your hands, wash your hands. Encourage your kids to wash their hands. Sing Twinkle Twinkle Little Star while they're washing their hands. Don't forget your thumbs. Don't forget your webbing of your hands. And be mindful that this will get better. We will get better, guys, okay? And I'll see you guys next Tuesday at 2:30 for the next edition of the Dr. Kre Me Show. I'm Dr. Kre. I'm a board-certified family medicine physician in the state of Alabama, and I help overworked, everyday people learn to live healthier, happier, whole lives through learning more. And the more education you learn about your health issues, the issues that are affecting us of today, which seems like coronavirus, but I'd rather you know. And I feel like when you know better, you can do better. You can follow me here if you're not already following me on Facebook. My page is Dr. Kre. That's DocTorkre. I thank you so much for joining me. I know I threw a lot of information at you. Share it. Tag me on your post. And I can't wait to hear from you guys. Be safe. Stay safe. Wash your hands. God bless.